Hi, I'm Maria Suset Karampatan and I will be doing the newborn care checklist. But first, I will be um, washing my hands and prepare so that um, the baby or the mother will not be exposed with contamination. The things needed are the bonnet, um, the uh, the baby's cover up, and the different kinds of scissors needed, and also we also need the alcohol pad for the injection, the thermometer, and the injections, the syringe, and then for the cord clamping. After washing, we should see to it that uh, we will wear the gloves and the hair net, and also we will cover the mouth with the face mask so that the patient will be protected from the airborne contamination. Time of birth 10:30 a.m. Okay, call out time of birth, sex of the newborn, and attach identification band. So the rationale for this is that there will be the identification band is important for nursing responsibility, so that the infant has an identification band in place both in arm and the foot area. So uh, it is for performing procedures to be done safely. And two identifiers to be done, the number that corresponds to number of the hospital. Then the mother's name also indicated, the sex, the date, and the time of birth. So it will be on um, uh, both bands written. Okay, deliver the baby into the mother's abdomen or into the mother's arms while assessing the infant's Apgar score at 1 minute, 5 minutes, and 10 minutes if response is poor after birth. So, the rationale for this, if Apgar score is 8, so no intervention is needed. But if the uh, Apgar score of an infant is obvious in distress, to correct the problem are immediately go to the uh, emergency and don't wait for the 1 minute Apgar score. So immediate thorough drying with the dry warm cloth, then remove all wet linen. So this serves as protection from cold, stress, and hypothermia. And also, drying simulates breathing, and it should be immediate action for all newborns, regardless of gestational age or birth weight. The head, the head should be dried very well, and because uh, substation heat loss can occur from head, which is about 1/4 of neonate's body surface area. Then early skin to skin contact. So we can have the baby on mother's chest. So this generally perceived to uh, provide warmth and bonding between the mother and the baby. There, it is less well appreciated are its contribution to immunoprotection of the newborn and protection from hypoglycemia. Properly timed cord clamping and cutting once pulsation stops within 1 to 3 minutes. So, this delayed cord clamping increases the infant's blood volume and iron reserves and reduces the incidence of iron deficiency anemia in infancy. No milking of umbilical cord towards the uh, infant. Instead, uh, you should drain to the downward away from the patient or away from the baby. Because when umbilical cord is forced into the body's abdomen, the pressure can cause tiny blood vessels in the brain to rupture, increasing the risk of severe intraventricular hemorrhage or bleeding into the brain's fluid-filled cavities. Clamp cord 2 cm with sterile cord clamp. At the other is at 5 cm from the base of the cut, and then close the clamp. This one first. Okay. And then the second clamp. Okay. It is recommended that clamping of umbilical cord is done at least 5 centimeters from the abdominal wall. If the umbilical cord is a broad base, it is also recommended to clamp at a safe distance from the base. Premature infants should clamp longer than recommended distance because there is a possibility of umbilical catheterization. Do not apply anything into the cord stand. Example, the alcohol or iodine. So, keeping the cord stump dry is the best way to promote healthy healing and natural break-off. Because alcohol should be avoided. The antibacterial effect of alcohol is brief and can be harmful to the baby. It also delays the usual 7 to 14 days of cord drying and separation by a day or two. Examine the number of blood vessels in the umbilical cord. This is way to see that there are 2 arteries and 1 vein. A single umbilical artery requires a search for congenital malformations. In some reports, a significant number of these infants have congenital anomalies, particularly renal and gastrointestinal malformations. Non-separation of newborn from the mother for initiation of breastfeeding. So, this prepares the mother and the baby to latch. So, the rationale for this is that the benefit of breastfeeding for the health and well-being of the mother and the baby are well documented. So, WHO recommends initiation of breastfeeding within an hour after delivery because this may reduce neonatal mortality by decreasing the ingestion of infectious pathogens. After completion of the first breastfeeding, perform the first complete physical examination. So, immediately after birth, the nurse performs assessment using the cardiorespiratory status, the breathing, the respiration, and the thermoregulation, and the presence of any anomalies. So, the nurse determines whether the resuscitation or other immediate interventions are necessary. When the infant is stable and oxygenating well, a more thorough assessment can be performed. This is also done to evaluate a newborn for maturity and well-being. Next is the anthropometric measurements. We have to take the weight of the infant, and then the height and the head circumference, and also the chest circumference, and also the abdominal circumference. These vital statistics of the newborns are important to determine they are used to confirm if the newborn is healthy. Next is perform eye care with erythromycin ophthalmic ointment on both eyes from inner to outer canthus of the eye. So, apply 1 cm ribbon to both eyes. So, it helps prevent ophthalmia neonatorum in infants of mothers infected with gonorrhea and conjunctivitis, and for any treatment of eye infections. Next, inject vitamin K 1 milligram intramuscular on vastus lateralis and the left anterolateral thigh of the baby. So this prevents and treat hemorrhagic disease in the newborn. Next is inject hepatitis B and the right anterolateral vastus lateralis area. 0.5 ml needed on the intramuscular. Next, on the left upper arm or left deltoid, inject BCG vaccine with 0.5 ml intradeltoid. To protect severe TB in infants because the neonatal immune system is still immature. This protects the newborns from serious forms of tuberculosis such as TB meningitis, infection of the brain, and military TB. It is the widespread infection of the babies. So take the newborn's initial vital signs to obtain accurate baseline measurement. Vital signs measurement begin to change from those present in intrauterine life at the moment of birth. And then you have to cover before preparing to be with the mother for rooming in.